Hey guys, it's Dr. Masood, your trusted doctor, and I want to talk to you today about, dementia. And I know for some of you guys, if you are dealing with dementia or a loved one, you're a caregiver, that can be definitely it can be hard, it can be frustrating. There's times you might feel like you're losing your mind. And I want to encourage you, if you are a caretaker, first of all, to definitely take care of yourself, because it's really hard to take care of somebody else if you're not taking care of yourself. So I'd encourage you to do something special for yourself as well if you are a caretaker. The other thing is that I do want to talk to you about dementia if you're worried about it. First of all, there's obviously genetic factors that are always going to play a component in anything. But what research has found, and it's called the Framingham study. It was a study, a very large study that was started in about 1948 or 43. I can't remember, but there was about 5,000 people that were involved in the study, and that's a lot of people. So it was a large cohort study that they actually did, and they followed people for about 10 years. And what they found out was something that may shock you. They found out that people that actually slept longer than 9 hours, they had an increased risk of developing dementia by 2 times as much as compared to people that didn't sleep 9 hours a day. Now that's a little scary, to know that fact. But here's something else that they actually found out. And I want to point out is that they also found out that people that had less than a high school education and slept more than 9 hours a day, those people actually had 6 times the risk factor of developing dementia. So on one hand, they had 2 times the risk factor of developing dementia. Then on top of that, if they were less educated, they had 6 times the risk factor of developing dementia. And so, we want to point out is that, number one is that I want to tell you that if someone's, sleeping a lot, that might be an early warning sign that they may have issues in the future with dementia. And so, it's not like we're going to say, go wake them up. That's not what we're saying. But what we're saying is something that you should be aware of, and then you should take proper procedures and steps so you minimize your chance of developing, dementia in the future. So number one is that, make sure that the person's not diabetic, that they don't have high blood pressure, that they're not genetic, factors, that they don't have poor health, because those are things that you could, address immediately. But then there are other things that you could also address that you could look at, going to a doctor like myself, like functional medicine, where we take their blood, we look at their vitamin D levels. And a lot of physicians will look just to see if they're in the normal range. With functional medicine doctors like myself, we want to make sure that they're the optimum range. There's a big difference. Then the other thing is that we want to look at is how the systems of the body are working. Are they working normally, or is there a way that we can optimize the functions in the body? And so we're looking at, things like their adrenals, their thyroid, their brain function, their gut function, and then giving them proper, not only supplements, but proper, tailor-made diets and nutritions and exercise plans, individualized, treatment that can optimize their health. And by doing those types of things, you lessen your chance of actually developing dementia because you're in a better state of health. But there are other things that you want to be aware of, like environmental factors. Or do you live next to power lines? Those are things that we know that are increased risk factors for causing damage, to the brain. Other things that you may not be thinking about, but air pollution. Your occupational exposure to pollutants and the pesticides or the air pollution that you may be working in. I was watching a guy the other day. He was cutting bricks and without a mask on and just breathing horrible toxins into his lungs. Not only a good thing for his lungs, but it's not going to be good for his brain either. And so there are things right now in your control that you can do to help yourself lessen those risk factors. Other things that you might want to think about is your diet. That look at your diet, let food be your medicine. Are you eating a lot of processed foods? Do you have, every time you chew, do you have amalgam fillings in your mouth? And that friction constantly, that mercury, can be leaching into your brain and into your body, which is just not a good thing for you. Other things is, your deodorant that you're using, does it have a lot of aluminum in it? Are you getting, vaccinated all the time with certain chemicals and toxins that you're putting into your system that could be a risk factor for you? So there are a lot of things, guys, that we do on a daily basis that we don't recognize that we do, but our lifestyle can definitely increase the risk factor of developing dementia, or actually could decrease the risk factor of developing dementia. That's a choice that you ultimately make for yourself and for your family. And so I want to encourage you guys to live a healthy lifestyle. The more natural, the better. How we're cooking. We want to make sure that we're not using, pans that are non-stick, because all those chemicals that have been sprayed on there that we're going to be cooking on, and that's going to be absorbed and that you're going to be eating in there, it's just not a good thing overall for you. Making sure that your blood levels are optimally working well when you're going to a functional medicine doctor like myself and getting those levels checked, where you're exercising on a regular basis, and not just exercising your body, but also, that study had shown, the Framingham study had shown that people that are educated are less likely to develop dementia. So hey, make sure that you're doing crossword puzzles, that you're learning something new on a daily basis, that you're challenging yourself, where you're even though you're getting frustrated, you're working through the problem. So all these things can help you stay healthy, lessen your chances of developing, hopefully, dementia. All right, take care, guys. There's a lot more that I could have mentioned on this video, but just because of the time frame, I can't go into the essential fatty acids and right ratio and all those other things. But there's all that information's out there for you if you're something that you're serious about, going further involved in your health. Give us a call or find a doctor like myself that can help you and guide you and coach you in the best health that you can ever attain possible. Take care, guys. Signing off, your doctor, your trusted doctor, Dr. M.